Welcome, everyone, to our February forum, where we're celebrating Black History Month with a focus on health equity and COVID-19. So if we could move to the next slide. Our agenda today is taking time this morning to, like I said, recognize Black History Month and all those that were on the front lines helping us to get to the point that we are at right now. We're going to go over some operational updates, some communication highlights, some engagement and outreach next steps, and then open up the floor for discussion. So what we want to do is we really want to take a look at what brought us here and how we're getting to a place where we are focusing on health equity, care, access, and affordability. During 2021, we noticed that there was a special enrollment period because of COVID-19, where 2.8 million people gained healthcare insurance. And a lot of them were our people of color. Next slide, please. A lot of the folks that we're looking at that we've helped over the last couple of years, we can look at the gender and racial disparities here and the education and how this affects not only race, but how it also affects class. Class as a people. Next slide, please. We noticed that our worst outcomes manifested in with our African American communities who faced higher risks and worse outcomes. And so we dive back into that data to reveal some of those disparities and understand the scale and the scope that it had on the lives of people of color. In response to these disparities, a number of initiatives had taken place and were launched. So we can head to the next slide. This is a slide that actually talks a little bit more if you want to dive in and learn a little bit more about your unsung heroes that impacted the COVID-19 epidemic, some of the physicians that brought vaccines to hard-hit communities, and you can also look at the legacy of Black leadership in healthcare. These slides will be shared with you, and those links are active. The American Rescue Plan was one of those initiatives that really made the way for low and middle income Black families to make health insurance more accessible. And overall, uninsured rate decreased from 10.3% in 2020 to 8.9% in 2021 due to those policies. Next slide. You'll also be able to see how the insurance rate dropped if you go to this slide, and you'll be able to see that downward trend of the uninsured rate. It continued to decline, and the number of people who are uninsured decreased by 1.9 million in 2021 and another 3.3 million from 2019 to 2022. So I didn't want to forget everything that we went through coming out of COVID-19. Thank you to all of our partners, and I will turn it over to Chris Bresco for our Medicaid Renewal operations update. Thank you.
Thanks, Kyla. Good morning, everyone. Welcome to today's get together. I'm glad everyone survived Snowmageddon. The news, I guess, reported a little bit. It's gonna be a little bit worse than it was. I'm in Middletown, only got 6 inches. I was hoping for 10. But anyways, moving on with Medicaid renewal operations. If you go to the next slide for me, please. So you've seen this slide before. We call this our waterfall slide. Green shows our progression. So we have now mailed renewals to 11 of 12 groups. What does that tell us? That when we mail our March mailing, that'll be the 12th and final of the unwinding period. And then we will begin. The big takeaway from this is, well, two takeaways. One is we have conducted 3 renewals with children up to this point. And the second takeaway is that as much work as everyone in this call has put into making the unwinding period a success and bringing Medicaid back on line with the renewal process. What is the byproduct of good work is more work. So starting, in the beginning of April, we will once again begin mailing for cohort one. Our May cohort will get their second round of renewal notices. Of note with this though, on this go round, only active renewals will receive notices. Those who will be passively renewed will not receive a renewal notice. That is a good thing. We want to make sure that people understand this so that by not receiving a renewal notice, not to be concerned. Some things still work out with that, but that is the way forward. Next slide, please. This slide is how we track our progress with our renewals and the status by type. This is found again on our staycovered.ri website. Just go across the top banner where it says data dashboard, and you'll have access to all this slide and a number more that will give you a really good snapshot of where we stand with our renewal process. Takeaway from this, we'll stay on the left side, the individual level data. And this is, I'm only going to talk May through December. We're still refining the data for the January cohort, which is our first cohort with children. That will be updated as of Friday. So if you go to the Stay Covered website, probably Friday afternoon, there'll be an updated data. Just look in the lower right-hand corner of the slide. It'll give you the updated date. That will have a little bit more refined and granular data on our first cohort with children. I do have some information for you in a later slide, but come Friday, you'll have it available on the web. So just a real quick takeaway from that left-hand slide. The top just shows our active versus passive renewals, and you can see our numbers are looking really good. We've stayed well above the 50% mark, or at or above our 50% mark for our passive renewals. As of December with the individual data, and just to explain the individual versus the case level data, the numbers look different for the case level data. So picture, for case level data, picture Chris Bresco is a Medicaid recipient, but in my household, I have 3 additional Medicaid recipients. That would only count as one case. On the left side, we go to the individual level, so you can see each individual Medicaid recipient and how they stand. So if we look to the left side on the bottom, we've done right around 125,000 complete renewals closed out. Of those, almost 70,000 of those were passive renewals. That is in the top tier of the country in terms of passive renewals for our Medicaid beneficiaries. Procedural terminations, we're running right around 35,000, to be expected, and not to be a point of concern. With those procedural terminations, though, there are, and I won't get into it today, we've talked about it before, but there are any questions, I'll be more than happy to entertain them either offline or later. I will stay on the call till the end to answer any questions. Is procedural terminations, there is a time frame post renewal closing date where those who were not able to return all the documentation required or have an issue, there is a set time frame, 30, 60, 90, 120 days, where they still have the ability to retain their benefits, and we will work with them to make sure that happens. And then those determined ineligible, kind of a small number comparatively, is only 7,000-ish. So overall, we're having a very successful renewal period with not a lot of people losing benefits that are being negatively impacted. And those cases that do come up, we're handling those as soon as they pop up and trying to make sure that we keep all of our Rhode Islanders covered with medical benefits. Next slide, please. So I talked to you about a little bit about the children. This is the first cut on our data for our January cohort for children. I know this is near and dear to a lot of your hearts. So in the January cohort, which is the renewals that were mailed out in the first week of December of 2023, we did about 15,500 children. Of those, you'll see 73% of those were renewed passively. Automatically renewed, no requirements on them to conduct anything, turn in anything. Their Medicaid benefits continued. Another 1,500 renewed by submitting their packets with the documentation required, and they continued their benefits. We're still looking at 1,600-ish renewals that are incomplete. That is not to be unexpected, and we're working with those people to ensure that those renewals get completed and those who are qualified receive their Medicaid benefits. About 2,300 procedural terminations, also sitting at 11%, which is in the national average very low. And then only 300, just short of 400, were determined ineligible overall for Medicaid benefits. Again, any of those that had a concern with their renewal determination, those are being handled through the appeals office, and that is a ongoing process, and we're not seeing a real issue with that process in terms of making sure that people receive the benefits that they need when they need them. Next slide, please. And this is just a slide for your edification. And I know that Sierra is going to make these slides available to everyone once the meeting is complete. But this is just a breakdown in case anyone was wondering by municipality of where our children are that are receiving our Medicaid benefits, just for your own edification. And with that, I believe that is my last slide, and I will turn it back over to our communications team. Thank you.
Thanks, Chris. Hi, everyone. Stephanie is here from Communications. We don't have much new to share this month at our forum, but we'd just like to highlight a couple existing resources that we think may be helpful as we get towards the later portion of our unwinding period. Next slide. First is just a reminder that we have our communications toolkit that's focused on sharing messages about renewals for households with kids. A reminder of some of the creative assets that are available in there are some social media images, some sample newsletter content, sample robocall script or text messages, depending on your organization's capability to send out that information. We greatly appreciate you considering it. And we've got messages and images in there that are available in English, Spanish, Portuguese, and Cape Verdean Creole. Next slide, please. And we'd also like to highlight our Helpers Handbook that we have on the website. This was created by the Protect Our Healthcare Coalition. Thanks to anyone who may be on the call from POHC. Thank you for developing this resource. It's very comprehensive. It has answers to a lot of questions that organizations may be getting about renewals from folks in the community, especially families. One resource in particular within this handbook that we'd like to highlight is this table here, which I believe is in the 15th section of this handbook. Like I said, it's very comprehensive, but it shows based on the type of question that someone might be getting, where they can go to get assistance. So there's connections to CACs, to SHIP counselors, 211, ripens information, all kind of advising folks whether they are on MAGI Medicaid or if they're the EAD, elderly and disabled population, who would be the correct point person to escalate that question or concern. And you can access the Helpers Handbook on staycovered.ri.gov. If you go under the Community Organizations tab, that's where you'll find this resource. So just wanted to make sure that folks are aware of this. I know we sent it out in our e-blast last month, but it really is a great comprehensive source of information about Medicaid renewals. And I think that's it from me. So next slide, and I'll turn it back to Kyla, I believe.
Thank you. I'm here with you all. We can go to the next slide. So we've opened up our third cycle of the mini grant applications, and that cycle has been extended to March 1st for the deadline. So if you need more information, feel free to click that link. One of the important aspects of the third cycle of our mini grants is that you can apply for the mini grant for each section of our, for each categories. So if you wanted to apply for language, you'd be able to apply for a mini grant up to $49.50 for language or technology, or training or outreach. So you have the opportunity to overall get some substantial funds that we hope to supplement the work that you've done between January and March 1st. If you have any questions, feel free to reach out to myself or Trina. There is an electronic application that you can fill out, and then you'll send in your budget form to myself and to my colleague Trina, and her information is on the website. And that's all I have for this particular slide. We have a specialist, a community engagement specialist. I believe she is on the call. So I will turn it over to her. Her name is Melinda Howard, to talk a little bit more about the Mobile Navigator program.
Good morning. Thank you, Kyla, and thank you everyone who's presented. I am working to schedule the Mobile Navigator program, which is for specialists to go out into the community. We can have 2 specialists, up to 2 events a week, and they will be set up to assist event attendees on a first come, first serve basis. And we are looking for people who are already planning events within the community. And if you would like to have a mobile navigator at your event, please contact me at EOHHS, and I will put my email and cell phone number in the chat.
Thanks, Melinda. Lastly, these are the reminders of the ways that we know that you all are helping to get this message out. Continue to visit staycovered.ri and download any materials and share any materials with your network. Please share information about renewals in a newsletter or in your social media feeds. Print and distribute Medicaid renewal materials at upcoming events and your outreach opportunities, and connect with us so that we could be helpful and send out a mobile navigator to support your outreach events. And here are our key messages for households with kids. Households with kids will get their renewal notices between December 2023 and April 2024. Make sure that you're telling people to update their contact information and sign up for text alerts. Watch out in the mail for yellow and green notices that come from the state, and have people open them right away and take action. A dependent may still be eligible for Medicaid even if their parent or guardian isn't eligible. And help is available near you. We have so many champions and partners in this community. If you need more detailed assistance, you can find it on our website. And remember, this is going to happen every year. We hope to support you every year in this endeavor, and we thank you for all your support thus far. That concludes our presentation for today. Are there any questions? And we can open this up to the audience.
So, Kyla, I see something in here about affecting people with SNAP. Yes, I guess even though the renewals per se are not connected to a SNAP renewal, if we found that people have increased, income, it could also affect other programs like SNAP, TANF, childcare. So if this is the first time our system is seeing that there's increased income, it makes sense. It's not connected to the renewal though per se. So we're not looking at SNAP cases necessarily at the same time as the renewals. But again, if information is received that could affect another program, it would affect another program. I don't know if that answers your question, Denise, but that is true.
This is Kathy Herron, the Long-Term Care State Ombudsman. I have a question for Chris. Chris, when you put that chart up about, the ineligibility, what makes the 2% of the children ineligible? What is the criteria for saying these people are not eligible, or these children are not eligible?
Kathleen, thank you. Great question. Normally, the most common reasoning behind that would be an increased income. Yeah. Increased income in the familial setting will go ahead and cause a child to be ineligible.
Thank you.
You're welcome, ma'am.
Stephanie, I don't know, or Kyla, do you want to handle the hands up or do you want me to? It's up to you guys.
Okay, Wendy, I think had her hand up next.
Yep.
You
Yeah.
want to go ahead?
So I'm gonna ask additionally onto, if the family has, their income goes up, but they have children with disabilities like autism or ADHD, high levels of diagnosis. Is there specifically resources that get sent to parents because they don't qualify for health insurance anymore because of the increase?
So I don't, and I'll just take it if no one else, if it's okay, but they will get, as anyone else, Wendy, they will get a notice about a QHP option. There is no specific, we wouldn't necessarily even know that that a child has a disability, except through claims data, if they were on regular, like Medicaid through the MAGI process, which is their income. So again, if there is a family that happens to have a child with autism and they're no longer eligible because of income, they'll get a notice as anyone else would, which basically says you're ineligible because of your income. If we're incorrect, let us know. But if we're, if this is your income, what you may be interested in is purchasing a QHP, and it would send them to that through that pathway. Again, if we're talking children who are on Katie Beckett, that's a different story. Those are children with, naturally that are disabled and meet a hospital level of care. They're not getting clinically redetermined. They're just getting redetermined based on income. And most of those kids, unless they have a new trust or something like that, they would not be coming off Katie Beckett.
Thank you. Yeah, I had a family that, she dropped off all cause on the application, on the renewal, it does ask if there's children that have been diagnosed or that was sent in. But with the child that has, ADHD, they get called because of behavioral, hospital, ambulance, so it's a very difficult case. So just having, all clients prepared on what to expect, especially if they're gonna kick off, because everything's very expensive.
Yeah, my strong feeling, unless others, I don't know if anyone else is on the line that could add anything else, but is to encourage people to go through HSRI and to try to, and again, it's not perfect, but to choose a plan that would best meet their needs in terms of the medications and the therapies and that sort of stuff. I think what's, the unfortunate hard truth is, children are eligible up to about 256% of poverty in Rhode Island. And so if they're over that, they are off, at least through the MAGI process. Again, if a family believes their child is disabled and meets a hospital level of care, what they should do is apply for Katie Beckett for that child. So that's really important as well. ADHD, I can tell you alone is probably, we're talking, for those folks who aren't familiar with Katie Beckett, it's literally for children who would otherwise be institutionalized if they were not on this, on Medicaid and receiving supports at home. They would otherwise have a disability significant enough that they'd be in some kind of an institution. So it's not a low bar, it's a high bar. But if someone happens to feel like a child may qualify, they should absolutely start the Katie Beckett application process as soon as possible.
Thanks, Lisa.
Sure.
I think Nicholas had his hand up. Next.
Good morning. Happy Valentine's Day, everyone. Quick question, on the slide related to the 15 months, now that we're in month 14, does households with children also include children with exceptional disabilities receiving LTSS?
Yes, Nicholas, we purposely put all of our children or families with children at the end of the unwinding cycle. And then that will begin, once they're renewed, receive their benefits, that will begin their 12-month continuous coverage. I hope that answers your question.
It does, but that would be the last cycle of that population of kids would be this month.
Correct. It'll be the March mailing. of renewals, which will close on at the end of April.
Thanks, Chris, for answering my question.
Yes, sir. My pleasure.
So I think Stephanie was next, right?
Yes, thank you so much.
Sure.
So similarly to the question regarding children who are no longer eligible for Medicaid via Magi, and being encouraged to either apply for Katie Beckett or go through HealthSource, how are children who are eligible for Medicaid via SSI, once that familial income goes above the limit for any SSI payment, I'm assuming that Medicaid would be cut off as well. What happens in that sense? Since the child is already recognized as disabled, would that automatically roll over into a Katie Beckett, or would that family now have to go and apply?
I don't know if I have any of my DHS colleagues on the line, but my sense is they would get a notice, and the note, because they're on SSI and now no longer eligible, because SSI equals disability, I would believe they would get an ex parte notice saying that they should apply for Katie Beckett. I can find that out and we can send it back with the minutes.
Great. Just
but
because, I mean, yeah, that seems like it would be a really arduous process for families that, like what would happen in between, because the Katie Beckett process can take a while. So what would happen for that child in between is a big concern.
Yes, you're absolutely right. And I just want to be clear that so basically, if someone is on SSI, we probably, so first of all, children or adults on SSI did not go through this renewal, as everyone knows, they're exempt. So what would have to have happened is during the PHE, the parent possibly, if the child was connected to the parent's household, sometimes children are their own households, after 18 years old. So basically it would be their own income, which generally a disabled child would have very little. You're right that they could have something through the parent, like some kind of a retirement or disability or deceased parent, that could affect the income. To me, I feel like if I will get an answer to that in terms of if our system will recognize that there's a disability and send out a Katie Beckett application or not. That's what I don't know. I would encourage parents to absolutely be on top of that, because it could take up to 90 days to determine a disability, as you know, for children and adults. So
Thank you.
all right, I think Wendy, right?
I have one more question. Now for the renewals, are we counting family expenses whatsoever, or is it just?
No, it's income only. Magi is based on income only. So it does not take into account anybody's expenses or resources. It's simply income. Laura, I don't know if you're just not on mute or if you have a question.
Sorry.
Well, if that concludes all of the questions for today, then we appreciate your attendance. Feel free to send any additional questions that you may have our way.